had an autoimmune phenomenon for 30, 40 years, which I refused to take medications for, and I just changed my lifestyle and nutrition, but never quite got there until I started to understand regenerative medicine about 10 years ago. I started to use it on myself, IV infusions and nebulizers. I saw things, symptomology changing. I started to explore that world and use metrics on me to see what is happening with my metrics and why is this happening? And then I started to see how can I incorporate that into my existing surgical practice with the patients that could potentially benefit from this. In my practice, it's not about nib, cut, stitch, and go home. It's a whole process that I put together on my team. I have an amazing team where we do things before surgery, during surgery, after surgery to give that whole regenerative, that whole wellness or that optimization of your healing through shifting cells. So all of this stuff is where I'm at now.
Hello there, doctors. In today's episode, I have the incredible Dr. Shoib Myint. He is a board-certified oculofacial plastic surgeon practicing in Las Vegas, Nevada, and also Beverly Hills here with us. And today, we're going to talk about the amazing clinical experience that he has regarding regenerative medicine reset. So we're going to talk about what that means and dive into that and what he's going to share with us at the summit. So welcome, Dr. Myint.
Thank you. Thank you for having me.
A conversation before we started, I was just blown away at your experience. And you've been practicing for over 20 years, wrote 4 books, probably a lot more that you haven't mentioned about, talk all over the world, and now focusing in aesthetics, now in interaction with regenerative cellular reset. So tell us about what that is. What is regenerative cellular reset?
Well, first of all, thank you for having me. I appreciate it. It's a loaded question. It's a very good question. I think that it's not about rejuvenation the way I see it anymore. It's about regenerating the kinds of cells in our body that lead to certain conditions and ailments and diseases and processes that we all get. And how do we take those particular cells which cause these ailments? How do we take those cells, signal those cells to change, right? And if we can make those cells do something different by instructing it, wow, what an amazing outcome that could potentially happen. And this is where regenerating of these kinds of modalities happen with stem cells and mitochondria. There's so many things out there now that we're trying to understand to make that shift. And that's a pretty powerful way to look at it. And so I think it's just taking existing cells that are not behaving, reset those cells, and then let them loose.
Okay, so let's dive into how do you do that? Like you said, what is like it sounds straightforward, but it's probably a lot more involved. So how do you do that? How do you reset that cell and have it start the reparative process?
We don't know yet. This is all where we've been exploring this, and this is, I think, the future of medicine. This is where the bullet train's headed, and I think physicians and providers who understand it are proactive. And when they're proactive, they see things more clearly about how to position their practice, how to position their patients, and where things are moving. And if you are not in this space or understand it, my fear is that they're just going to be left behind because things are going to move very fast. And so the smartest thing to do is educate yourself and understand where this platform is, because you're not going to stop it. You won't be able to, it's moving. You just have to jump on and try to figure out how this is going to work. And it's happening in every specialty, as you know, neurology, orthopedics, internal medicine, plastic surgery, dermatology, everybody's doing it. We don't really know exactly, but we have lots of literatures and lots of studies and lots of ideas and concepts of how it could potentially happen from stem cells, from exosomes, from mitochondria, from peptides. There's so many different modalities out there. and from nebulizers, topical IV infusions, right? We're all in this together to explore and figure this out. I do know that a lot of it really works. I'm a testament to it because of my condition, autoimmune phenomenon, and I use it on myself, and it's amazing the potential it can have. So I do know that there are modalities currently that do work. There's some we're trying to figure out, and then there's some on the horizon. How it's going to work, we don't know.
First of all, before we dive into that, let's tell us what is an oculofacial plastic surgeon, and how it what is that specialty more focusing on, and then the second question is what made you decide to integrate regenerative medicine into your practice?
There's probably about 1,000, maybe a little bit over that, who are oculofacial plastic surgeons in this country. We have training of anatomy, physiology, mechanisms around the eye and the orbit and the midface first. That's where the training, and that's board certification in ophthalmology. So to understand my world, you have to understand the ophthalmology world first, the blood vessels, everything. So we're very comfortable, oculofacial plastic surgeons are very comfortable injecting surgery around the eyelids, the eyeball, behind the eyeball, and the orbit. That's our world where we deal with reconstructive and cosmetic in that area. And our specialty involves not only the orbits and the eyes and the brows, but along the midface, and now it's in the face and neck. It's a very super specialized area where we have that sort of a capacity to be able to handle. And so I see a lot of people with, in terms of functionality, with cancers and tumors around the eyelids. I used to see congenital babies that had issues with the eye, behind the eye, tearing problems, thyroid problems, eyelid malposition. And then from there, moving to the aesthetics, which is the positions of the brow and the upper lid and lower lid, the loss of volume, the face and the neck. There's all these little parameters. So that's sort of my world. And it's very, very curated. And so my transition from that to where I am now is because I had an autoimmune phenomenon for 30, 40 years, which I refused to take medications for, and I just changed my lifestyle and nutrition, but never quite got there until I started to understand regenerative medicine about 10 years ago. And I started to follow it, and I started to use it on myself, IV infusions and nebulizers, and was a significant change in my life. And I saw things, symptomology changing. I saw the way I was thinking and the brain fog. And there's so many little things that started to happen. Then I started to explore that world and use metrics on me to see what is happening with my metrics and why is this happening? And so I think through that journey, I really was sold that this is where things need to move, and it was moving. And literatures around the world are showing that it's moving. And then I started to see how can I incorporate that into my existing surgical practice with the patients that could potentially benefit from this from a cellular level, right? In my practice, it's not about nip, cut, stitch, and go home. It's a whole process that I put together. My team, I have an amazing team where we do things before surgery, during surgery, after surgery to give that whole regenerative, that whole wellness, or that optimization of your healing through shifting cells. And how do you do that? From the hair, from the skin to the wound, all of that. So that's where my shift slowly started happening. And I've curated my practice to only do that, and introducing microfat and nanofat through the San Diego concept, the platform. So all of this stuff is where I'm at now.
Can you talk a little bit about, and I love what you just mentioned, your treatment is not just one part, it's a whole comprehensive spectrum of pre-surgery and post-recovery and post-surgical recovery. Can you talk about that? Is that does that involve nutrition and supplements and peptides as well?
Yeah, that's a good question. There's no protocol in the country for that right now. I think we're all trying to explore it. I think the providers and the surgeons who are proactive understand the benefit and the power of that. So we're all trying to figure, okay, how do we do this? How do we make this a whole package instead of just a surgery? And I'm also exploring it. I have my protocols that I've created myself and curated it. It works for me. I'm still adding to it. I'm still taking things. I'm still trying to understand the human cellular biology to see where we can go. And I can tell you that what we're putting in place now, my patients are healing incredibly fast, like 1 day, 2 days, like I never got. 10 years ago, 10 years ago, they were way more swollen and such a long recovery that the recovery speed has significantly changed, right? So I know something is happening. So it's incorporating a lot of regenerative modalities. And you talk about peptides. We don't even know much about peptides. There's so many out there now. What's good and what's bad, we don't know. But does it make a difference? Yes. Stem cells and exosomes and the mitochondria, how do you shift that? So all of these things, I think we're all I'm trying to curate as well.
What are you doing in your practice that is accelerating the wound recovery? You said now before, it would take a long time. Now it takes like a day or two. What are you adding on that, making that difference?
I start with the consciousness. I start with the mentation. I start with the neuro, and then I work myself down. Meaning, your perception and your view of this particular procedure you're going to have. How do I eliminate as much as I can the increase in cortisol, the increase in stress level, the worries and all of those that releases these kinds of chemicals which may affect the healing process and affect the cells that I'm trying to get to heal. This is all part of it, right? It's not just a section that you just do. I mean, you have to look at the whole picture. And so we start with meditation, we start with nutrition, we start with putting them on a journey, we start with oxygenation beforehand to implement them. We start with red light therapy to optimize their skin after a facelift or neck lift. We start with all of these things. And I think for my patients, like when they come to see me and they're going to have a procedure and they see this stuff, they're pretty... They feel to some degree a comfort level. Oh my God, this is like not just a cut. This is actually, I'm going on a journey. I'm going to rehabilitate what I want. And these are all the steps that need to happen. So for them, there's substance there, right? Instead of just going and cutting and then paying for surgery and go. So I'm trying to create that world, right? And patients see it and they like it and they know that there's value in this, right? In terms of their outcome and their spirituality and their movement in life and their journey, and how do you incorporate that? So those are some of the things that I'm putting in place.
That sounds like something very unique. Now, you're going to be one of the speakers out of many speakers at the summit in Torrey Pines, July 29th to the August 2nd. What will you be talking about at the summit?
Well, I do a lot of microfat, nanofat around the eyes, part of because, and mid-face. And so I've been giving the lecture before. There's so many amazing presenters who do this around the eyes and face and stuff. But, because of the anatomy and the risk of blindness, and there's a lot of stuff that I've talked about before, but on my talk is going to be on mixing microfat, nanofat, mixing exosomes. How do you increase longevity of the fat cells, the regenerative cells, and how do you curate that, tailor that? So I think that's going to be my area.
That is fascinating. I'm always wondering, when do you use microfat, when do you use nanofat, and and how do you add exosome, and how do you know what works? So doctors, if you're listening to this, come to the summit and talk to Dr. Myint and listen to his lecture to find out more about that. So with the summit, coming up in July, end of July, how is that different than other regenerative conference? And before this, we had talked about it. And so how is it different? And it's probably one of the best kept secret of all regenerative conferences for doctors out there. What is your take on that?
It's a very interesting summit because you're bringing together some of the best minds around the world who are in so many different disciplines who come together to really talk about the shift that's happening, right? The shift that's happening internally. And how do you incorporate an OBGYN? How do you incorporate it with hair transplant? How do you incorporate it with the skin for dermatologists? What about for internal medicine with metabolic diseases? What about plastic surgeons in their face? And, how do you optimizing wound healing? Like for all of these disciplines, it's the common denominator, which we're all trying to figure out, is how do you make your patients optimize, heal faster, feel better, look better by changing cells. And we have people who are brilliant, people who are doing research on a cellular level to show this stuff, right? And then you have people who are dealing on a broader level. So I went there a couple of years ago and I was blown away. And I've been to a lot of conferences over 25 years. I've lectured at most of the conferences around the world. And they're all good conferences, all of them, but none of them had this sort of angle, which is the angle the journey that I was moving in my world, in my personal life, and also in my professional life. And here's a platform that's sort of synced with what I want. And I came back and I was fortunate enough for them to invite me to talk, and I did. And I was very impressed with the panel and the people and the mind, and a testament to, for what I'm particularly doing, a testament to Patrick Denard group in Belgium, who they curated this concept of the microfat nanofat, which has been brilliant. It's revolutionized the way we approach regenerative and volumetric in the face and what you can achieve from it.
Absolutely. And I come from the orthopedic regenerative world, and the stuff I've learned, and since I attended the summit, I was able to integrate from the oculofacial plastic surgery view and the plastic surgery view into some of the things that I do. And what I've learned from last year, I was like, oh my goodness, all of us have our different little perspective and our niche, and how you can learn little tidbits from each expert is incredible. And like you said, the experts that are at the summit, these are the ones I used to read textbooks. I used to read their textbook, and now I'm meeting them in person at the summit. So, having said that, if a doctor were thinking about going to a regenerative conference, and they attend the summit, and what would you want to say to doctors that are interested in attending? What do you think they'll learn and get out from the summit?
This is a platform where you can go listen to some of the big names, and they deliver information in such a fine way where you can take that back to your practice and very quickly start applying these concepts. And they make it easy for you, from Tulip, who supplies the instruments, to the physicians who give you the sort of the bread and butter, to the sketch, to how to curate it, how to put things in pieces together in your practice to get started in this kind of a world. They make it easy for you, for somebody who's novice or is just learning this concept. And I have a lot of colleagues of mine who ask me, so, how do you do this? Like, how did you do the microfat? How do you get it out? And, what kind of outcome? Like, how do I get started? Like, what do I do? Like, what do I buy? And so this is a great platform for you to go listen to what's happening out there, where the future is, and then start putting pieces together that you can take back into your practice and start applying it.
Do you really feel that all doctors and all specialty need to learn about regenerative medicine, and that for them to kind of keep moving forward with what's going on with AI?
100%. I think if you're not on board with regeneration in healthcare and in medicine, you're going to be left behind. I have students that rotate with me from medical school, and I've had psychiatry students that are going to do our psychiatry residency. And at the end of the month, I always give students lectures. I assign a topic to them. And one of the topics I assign to most of these students is, tell me a little bit about how regenerative aspect will affect your specialty in the future. And some of them look at me with doe eyes, like, well, I don't know what you're talking about. And I was like, oh my God, that's so cool. Let me look into this. And at the end of the month, they gave me this presentation. It's fascinating. It educates me, for example, in the world of psychiatry, what they're doing in terms of cells and regenerative to treat some of these conditions, right? That's how much this is moving. It's moving to every discipline in medicine. How do you do it? I have a psychiatrist who now is curating a practice to just do regenerative on the side for the mental illness patients. And how do you do that? I don't know the answer to it. I'm just saying, they're opening their mind to explore this instead of staying in the box. So to answer the question, yes, I think this is where it's moving.
I'm so glad that we get a chance to do this interview. And doctors, if you are contemplating going to a regenerative medicine conference, check out the summit at Torrey Pine. You get a chance to meet Dr. Myint and ask him your questions, and explore his experience, because he's got 25 plus years of experience along with doing regenerative medicine. And that's what I have found out to be one of the best part about the summit is having all the experts in one room and be able to ask them questions. And what I found was so interesting was that, all of you guys are the world-class expert, but we can come up and ask you questions without, having to chase after you, because you're all there in the room and so willing to talk to the doctors and so willing to share your experience. Having said that, what is the one thing that you would tell you want to, if a doctor is attending, what question do you want them to ask you? One question that you think will be useful for them to ask you at the summit.
I would say, how do I take what you just said and put it into a cookie cutter approach in my practice? Where do I start?
I love that. And I'm definitely going to ask you that question.
I may not have all the answers, but I can help.
Absolutely.
I mean, there are people who are way more smarter and versed in this than I am around the world, who probably be able to answer that much more effectively, that come to this clinic, to this platform. But yeah,
your perspective would be different as well. You can ask the same. I mean, that's also the thing about doctors is that the same question you can get 10 different answers. It
just depends on how that provider, how that surgeon has set their practice will determine what kind of answer. Like they're doing certain things that work for them, that are particular for them, and they come from one angle. I come from one angle. We're all doing the same thing. It's just we're just sort of coming from different angles. Everybody, the people who are there, a lot of them doing microfat, nanofat for hair and skin and everything. I just do around here. So how do you avoid blindness? How do you avoid the danger zones when you're doing it around here with fat? What does that look like? That's where I can come in and help.
I'm scared of even injecting PRP into the, around the skin in the face, but I'm not scared injecting around the spine. Can you believe that? But I was like, anything above the neck, it's your guys' area. I'm not going anywhere near that, but I don't have any problem going around the spine and around the nerve like that. But, we all stay in a lane of genius and a lane of expertise at this point. So thank you so much, Dr. Myint, for being on this episode with us. And he will be there at the summit on July 29th to August 2nd, and is at Torrey Pine in San Diego. So you can't not go. At the location, fabulous. The venue and is fabulous as well too. So doctors, check out the summit. Check out the link below. Thank you, Dr. Myint, for being here with us today.
Thank you for having me. Appreciate it.